everyone. So in this video we're going to be talking about the 3 most important first aid skill that you or your friends or anybody else should have it. Well, let's not talk too much and let's get started. Before we get started with all the techniques we're going to talk about, let's bear in mind that that's not actually an essential first aid technique or any basic or something that you must know, because every first aid technique is important in any ways. Different websites has slightly different saying on essential first aid technique, but the below one, which will be in this video, appear in most of the website that I research. So the first one, and definitely the most common one that people will know, it's a CPR. So what's a CPR? CPR stands for cardiopulmonary resuscitation. Cardio stands for our heart, pulmonary stands for our breathing, resuscitation just rescuing. So when do you do CPR? CPR is needed when the person is having a cardiac arrest, which means he cannot breathe and he heart stop. And CPR is the simulation of the heart going, because you are giving compression to the chest, which is a simulation to the heart to keep pumping and make it pump again. So we will get into that very soon, but before we get into how to actually do CPR, let's just talk about what are the procedure or algorithm. So we have a algorithm which is called DRCAP. So I personally call it Dr. Cap, which is more easier to mean. So the D, so danger, which you recognize the danger on the scene as you don't want to put yourself in danger, which increase the amount of the victim. R, response. So you check on the victim response. If patient are unresponsive, look at his chest for 5 seconds and determine if the victim is breathing or not. If not, call for help and say the treating, which we will get into it very soon. Okay, then you move into letter C. But if patient is breathing, you want to put it into a recovery position, which the picture showing below. Then we move to C, chest compression. Pretty simple. You're basically doing compression with a ratio of 30:2. We'll get in more deeper later to a video. A stands for airway, which is after you finish your chest compression, you should open the victim airway. So the victim airway is open and you can either give oxygen, or in first aid we're just giving a mouth-to-mouth breath. So B is what we're just saying, a breath. So breathing is to give the oxygen to the lung, which there's still been oxygen in his body, which his brain won't be dying. Alright, so let's watch the video below and see what is it in it. As you can see, the first one, D, checking danger, very important. You don't want to put yourself in danger to increase the amount of victim, like I just said. Then R, by checking on it, you can tap on his shoulder, which is the collarbone, or maybe the middle of the chest, rubbing it real hard. If the patient is not responsive, then you can move into the C. And before that, you should call for help and say the treating. Point at someone and say, hey you, call 999, bring the AED and report back to me. Then you move into the letter C. Then we go into chest compression. As the video shows, place your heel of your hand on the middle of the victim's chest, then put your other hand on top and then cross the hand. Then press fast and hard. The depth should be at 1/3 of the chest and with a ratio of 30:2. Then we move into the airway. In the video you can see a technique called head tail chin lift, which is the most basic technique that you will use to open the patient airway. So to see, put your hand on the victim's forehead and the other on the chin and tilt the head and lift the chin. So the airways of the victim is open. Then breathing. By breathing into mouth to mouth, you should pinch the victim nose, open the victim mouth, and then give a breath to the victim that should hold for 2 seconds, then repeat with CAP until the help is arrived. In first aid, we have something called AREA, which is area. This is where when you should stop your CPR. Recommend to stop, not should. A first aid stands for AED. When the AED come, doesn't mean that you stop straight away, but you keep continue. But if you are really tired, you can just stop and let the AED do the thing. Then R, which is revive. So when the patient having responsive and he started breathing, you should stop CPR immediately and put him into recovery position as the picture before. And then E, which is exhaustion. So you don't want to make yourself too tired. So if you are feeling super tired, you should stop the CPR and let the other continue. You can teach a guy if you want to. Then the last A, which is ambulance. So when the ambulance arrives, you can just hand it to the paramedic and they will do their job. Just tell them how long you've been doing it and do you give shock or not. And that summarizes CPR. Alright, let's move into the next one, stopping heavily bleeding. If someone is bleeding heavily, their body won't be able to form a clot and then they could bleed out. It is very important to stop heavily bleeding, as they will go into hypervolemic shock, which is mean that a shock that you stop your whole blood circulation. So if you pay attention in your science class, you should know your heart need blood to pump and going in, which means if there's no blood in your going around your body, you're going to cardiac arrest, which your heart will stop. And especially for arterial bleeding, which is maybe your neck or your thigh where the artery are, they could bleed out and die within a minute. Alright, let's move into the next one. How do you actually stop bleeding? By stopping bleeding, we have two very simple ways to do it. Either you give a nice direct pressure, which you just press it right onto the patient wounds, but that one is only for minor cut. For major cut with heavily bleeding, you should put gauze on top, but don't press it because the patient might feel hurt. Instead, you can bandage it. By bandaging it, you can use any way that you know how to bandage. Just wrap it around the gauze where it can stop the bleeding. Then you should keep checking on the patient status and see whether he's okay or not, then report to the EMS. Stopping bleeding, we have the main thing we need to know is to prevent infection and stop bleeding. This is definitely we know, and that summarizes the whole bleeding area. So let's move into the next part, choking. So what are the causes of choking? Choking is meaning blockage of the upper airway by foreign bodies or objects, which prevent a person from breathing effectively. So that's pretty few signs and symptoms for adult, which that's immobility to talk, inability to cough, difficult breathing, skin, lip and nail turning blue, and the universal sign which the picture shows. So we have a technique called Heimlich maneuver. So it's a maneuver created by a person named Dr. Heimlich. So we call it Heimlich maneuver. How do you do it? So let's now move into how to treat choking. Watch the video below. As you can see, you stand behind the victim and then wrap your arm around him. You place a fist between the patient rib cage and belly button, or maybe you can just put right above the belly button. Place your other hand over the fist, then deliver a quick thrust upward and keep doing it until the foreign object is out. Very simple. You should try this at home with your friends. It's totally normal. You can do it. Probably your friend will feel a bit uncomfortable, but it's definitely fine to do it. So that should summarize our whole choking part. So now we're going back to a bit of CPR, which is kind of related because it's using an automated external defibrillator or AED. An AED is a device which gives your heart a shock to restart the heart back. They can be improve the surviving rate of victim, and it's very simple to use. There's only 3 steps on using it, and the device will tell you everything to do, and you just have to follow instructions given out by the device. So how do you do it? Let's watch the video below. As you can see, the moment you open the device. Okay, so now let's move into how to actually use an AED. As you can see the video, when you switch on the device will tell you attaching patch. Then you should attach the patch with the image on top of the patch. Don't worry if you messed up, because the picture is to show, just to give you a guide. So it's totally, you just have to put it right in the same place. So then you after you attach the shock pad, you then connect the shock pad to the device. When you connect it, you can hear the voice. It will tell you this. When it say analyzing heart rhythm, you shouldn't touch the patient or anybody else. So whoever doing CPR, stop immediately. After you finish saying, then you should follow the if shock advised, then you should press the orange button, which is this. After pressing it, the device will tell you to continue CPR. Then you should continue CPR, and every 2 minutes the device will tell you to shock one more time or analyzing heart rhythm. So what if the patient have a bad chest, hairy chest, or is wet? As you can see in the video, if the patient have hairy chest, you should just shave the part where you need to attach a pad. Don't need to shave the whole chest, because it's a waste of time. Just shave the part, which is this. What about wet body? Simply dry it out with towel or anything, because you don't want the water to burn the skin, which the patient might cause 2nd to 3rd degree burn. And do remember, if you're performing AED and CPR on a girl, you should take out the bra, and then you should cover it with anything for the privacy. That should summarize AED. Okay, that summarized our whole first aid technique. Just to add on a bit, I just want to tell you guys why first aid is important. So with an interview with a Red Crescent volunteer first aider with 11 years experience, he said that first aid is important because it can help people to manage pain and to give basic first aid when the help arrives, when the help is coming. It is true that having first aid training does help save lives, but that's not all. Giving appropriate first aid can immediately help a person reducing their recovery time and make the difference between the patient having temporary or long-term disability. And you will learn how to remain calm in emergency situation. First aid training will make you more confident and comfortable, which means more effective and in control when you need to be. In some situations, if a victim doesn't receive basic first aid care immediately, their situation can get worse. Being able to provide basic care, you can stabilize a patient until EMS arrives. You also be trained in how to collect information and data about what happened and the victim's situation, which then you can pass on to the EMS to save time and being a variable link in the chain of survival. So thank you guys for watching this, and I hope you learned something from this video.